Well, good morning and good afternoon, everyone. It's great to be back together for our last class in the 2023-2024 Maternal Mental Health Policy Fellows cohort. It's hard to believe that it's been almost 12 months. Graduation is next month. And today we have a really great session in store for you. We have another guest presenter who you'll remember from one of our prior sessions. I'll introduce her in just a moment, and we're going to be covering new maternal mental health treatments, some of them just recently announced as approved by the FDA. Psychosis in the criminal justice system, a really important topic that's something you all need to know about as leaders in maternal mental health, and then media advocacy. Really excited about today's session. We'll, of course, go over graduation requirements. We also have a post-test that we want you to complete live today. Or if you're watching the recording, of course, do that retrospectively. We will go ahead and advance to the next slide. All right, thank you again to Sage Therapeutics, who makes this program possible. Couldn't do it without them, and appreciate them. You'll get to hear from Sage at our graduation next month. Here's a full agenda. We're going to recap the last meeting like we normally do. We're going to also talk about some national updates. It wasn't on that cover slide, but some important things that are happening this month in May at a federal level. So we'll go over that briefly. Then we'll talk about those three topics: treatment, maternal mental health treatments, mental health in the criminal justice system, or maternal mental health in the criminal justice system, media advocacy, and specifically working with journalists and developing relationships with journalists. And we'll talk about our journey doing state policy work in California, working with a particular journalist. Crystal's going to go over all of that. We'll do a general roundtable on all that you heard, any other questions you have about the program. We'll do our post-test, and then we're going to do graduation reminders and wrap up. So pretty full agenda. We move into the next slide. So just wanted to recap what we did at the last meeting. You might recall that we had guests from both the Department of Public Health from Massachusetts and Colorado. And we also had behavioral health representation, Department of Behavioral Health representatives from Colorado as well. With Massachusetts, we just wanted to remind you, what's going on there and why was it interesting to hear from them. Massachusetts has the first and only standing legislative commission on maternal mental health. They actually call it the Ellen Story Postpartum Depression Commission. It includes legislators and members of the community, as well as federal agencies. So essentially serves as a task force, but it's codified into law and hosted in part by the legislature. Really interesting to learn about their model. Their Department of Public Health and Medicaid has recently aligned efforts through a plan to focus on screening and reimbursement for maternal mental health, and are requiring Medicaid health plans report the new HEDIS screening measures. For those of you who are trying to remember, like, what exactly is that? We have a blog post on what the HEDIS measures are. And I don't know, Crystal, could I tap you to find that on the Policy Center website and drop it into chat? We have a new report coming out on HEDIS as well that highlights the actions the top states are taking to drive improved screening in their states. So that will be forthcoming. So to be on the lookout for that. Massachusetts also has created this new data plan for maternal mental health or perinatal mental health, which was shared at the last meeting. So if any of that sounds interesting and you need a refresher, the slides and the recording are in our folder on the drive. Hopefully y'all remember how to get there. If not, don't be shy about asking Stacy for help, and maybe we'll even drop a link into chat here in a minute to the drive, so it's handy. Colorado is one of the other states whose public health department has been doing work in this space for quite some time. They started with a campaign, an awareness campaign. They call this pregnancy-related depression, which I think they're coming to realize is a little bit confusing because it looks like it could focus on just pregnancy. So I know that they're reconsidering the name for that campaign, but really poured a lot of time and effort into an awareness campaign in Colorado. They also helped develop a maternal mental health collaborative, working with private philanthropy and nonprofits in the state. They utilize the framework that we developed. It's on our website and in the folder for collective action or community action, the community action toolkit in Colorado. And they're also focused on behavioral health integration, including adoption of the new Alliance for Innovation on Maternal Health bundle for perinatal mental health and substance use disorder. So Colorado has really been leading the way in a lot of ways around maternal substance use, which they presented. There's also an AIM bundle on SUD, and they're actually their policy fellows that joined this cohort last year developed a maternal SUD training that they rolled out in Colorado, and that will soon be available nationally. So stay tuned for that. We're working with those folks and Postpartum Support International to roll out online SUD training. So really good stuff. Take a look again if you need a refresher and want to tap into those resources. Questions or comments about Massachusetts and Colorado efforts? Feel free to unmute your line or drop it into chat. Okay, nothing yet, and that's okay. All right, next slide. So joining us today, and she'll be presenting later in our session, not right away, but I wanted to introduce Crystal McCauley. Crystal, you want to turn on your camera and just give us a quick wave? Crystal's joined us for a prior session. She is. Hello, Crystal. She's going to be supporting the session today around media advocacy and talking about the journey that our organization took with developing a relationship with one particular reporter. And you'll see the 8 or so articles that have since been released, including some of them that hit the national stage through NPR. So really great, a great intro to how to develop relationships and some of the fruit that can unfold as a result of those relationships with reporters. Next slide. So national, I'm going to spend 5-10 minutes talking about some important federal or national updates that we want to make sure you are aware of. This month, Maternal Mental Health Awareness Month was a big one for maternal mental health, including a couple of national efforts. You all might remember, and I know you do, because we've spent some time going over the 2023 or the inaugural maternal mental health state report cards in each of your states. We wanted to just make sure you caught the news. I think you have that the 2024, the latest report cards were released. The headlines are here at the top. 34 states improved their grades. That's awesome. But not by much. The national grade improved from a D to a D plus. Only 4 states managed to exceed C's by earning B grades. They're listed here. In 2023, there was just 1 state that earned a B grade. It was a B minus. So seeing some progress there. And 29 states received D's and F's. So still 29 states, which is a hefty number, are still, failing to serve mothers in any type of adequate manner. Here's what the homepage looks like. We will drop into chat the link to the report card page. Crystal, I'll tap you to do that for me as well. The Policy Center also released or unveiled its new website, so you can get to the report cards still at the top of our new web page. But Crystal, if you don't mind dropping a link into chat, that would be great. We can move on to the next slide. So there are 18 key measures this year. 3 of them were new measures, and you can find out a little bit more about those new measures on the website. I'll actually give you some insight into what they were. The HEDIS measures, there's one on prenatal, depression screening, and there's one on postpartum depression screening. And then the third new measure was whether the state has a perinatal quality collaborative, a PQC, that's prioritizing maternal mental health. Hopefully all of this sounds familiar because we talked about all these things in our Policy Fellows program already, including the perinatal quality collaboratives and the role of the PQCs in implementing AIM bundles to prevent maternal mortality, including the maternal suicide and overdose. So exciting about those three new measures. A couple measures were sunset for a variety of reasons and replaced with the HEDIS measures. But the remaining measures, or the measures in total in 2024, fall into these three buckets, just like last year: providers and programs, including provider to patient ratio of maternal mental health providers, and inpatient and outpatient programs, so hospital-based programs usually that support maternal mental health. Screening, of course, is a really big focus, since that's where it all begins and things tend to fall into place once screening starts. Looking at screening rates and states that require that screening be monitored by health plans. We also look at coverage and treatment, including Medicaid expansion and extension. You all might remember extension is postpartum Medicaid extension. So through 12 months postpartum, most states now have extended, but there's a few that have not. Treatment rates. So we're looking at claims data around how often people are getting treatment through claims data, and mandates around health plan quality improvement programs. So what are health plans, the payers, doing to effectuate change, since that's really where the rubber meets the road. So next slide. Here's a highlight of the grades by color. Take just a minute to find your state's new grade by color code here. And then next slide. Just an example of one state. This is actually DC, which is not a state, as our folks from DC, fellows from DC last year know all too well, but still included in the report card. So just to give you a snapshot of what the report card itself looks like. And then the next slide, we actually want to give you just a few moments to take time to review your own state report card. We also want you to start drafting an op-ed with your team. Stacy sent out this morning, which you may not have caught yet, the op-ed template that we've drafted for all of our fellows, so you or prior fellows to utilize to draft and submit to local papers or state papers about your report card grade. We actually think it'd be incredible. We know folks are busy, but pretty newsworthy that it's still Maternal Mental Health Awareness Month. So you could still squeeze in getting an op-ed published about why this is important and how your state has fared this year in report cards. It'll give you a chance to get some good media with your nonprofit or agency, perhaps, and of course, highlight the larger problem in the US. I am going to drop the op-ed template into chat right now, and we're actually going to give you just a few minutes. You can put yourselves on mute if you want, and one of you can chat each other in Zoom about who's going to create the op-ed template and give everyone access on your team. So we just want you to get started on this because we think it's that important that you have a little bit of time here. So use Zoom, or even if you have the phone number of your partner, feel free to put yourself on mute and call that person to figure out your plan. I'm going to drop the op-ed template into chat right now, and we'll come back in about 5 minutes. I just dropped it into chat. Hey, I wanted to check in. How are things going? Do folks need a minute more? Are you done? Kind of getting things teed up? You can use chat or just verbally provide some feedback. I'm going to assume that you all have had enough time, but I would appreciate some feedback in chat, or if you could take yourself off mute. Was that helpful? Did you get started? Do you need to reconnect with folks? Okay, Britta, thank you. Wanting to coordinate with another partner like March of Dimes. And then I think that was Yulia. Good time chatting, connecting with each other. Very helpful from Sequoia. Yep, Sequoia, we know you are in another country. I think Italy, if I remember correctly. Okay, got it. Yep. Thank you. Any other feedback on this? We, of course, would love to learn if you submit an op-ed, how it goes. We really encourage you all to try it. I've done it once before. You may or may not get the op-ed accepted, but it's a great experience nonetheless. And we're happy to help too. So if you want another partner, if March of Dimes, for example, isn't available and you need a nonprofit partner, tap us. We'll help you submit the op-ed to a local paper. You can help identify who would be the best fit, and we can help submit it as well. Awesome. Thanks, you guys. I appreciate that we had a chance to take some time to look at that. Let's move on to the next slide. I also wanted to share that this month, the first national strategy on maternal mental health was released by the Federal Maternal Mental Health Task Force in DC by the Health and Human Services Agency and SAMHSA and the Office on Women's Health. We did a brief blog on it. To be frank, the strategy is a little bit difficult to follow, I think, but the key concepts are there. There will be future iterations of the national strategy and a separate report on what is maternal mental health and why does it matter were issued to Congress this month as well. The Policy Center, we're working on a follow-up to both the task force co-chairs, for which I'm a member, but also around like next steps and low-hanging fruit. And we're also working on a strategy to support implementation of some of these issues, working with Congress, potentially this year before the election. So we'll see where that lands. If folks have had a chance to dive into the national strategy, and if you have particular insights, I think, all of you, whether you're nonprofits or state agencies, will have some insights. State agencies, I'm particularly interested in what you think. Is there something missing? What are you thinking in terms of like funding from Congress and things like that? So would appreciate your insights. Nonprofits, definitely you too, but I think I understand the opportunities for nonprofits pretty well. Questions or comments about this? We have that blog post on our website. I'm going to drop it into chat right now. If you haven't seen it, and I basically took some time to bucket out the themes in a slightly different way than the way the task force did, just a little bit easier to flow in my own brain. So questions or comments? Pretty exciting time. Here's the blog post. And just, one other thing to help connect dots here. This is really similar to what we are encouraging you all to do through your action plans, is to form a statewide, state-sanctioned task force, right, on maternal mental health care. So we figured that the federal government should be doing the same thing. One of the other things that this task force will be doing is creating recommendations for states and governors. We think much of that will align with some of what we've already produced around strategies for states in our roadmap for change, which I'll drop into chat too, but just wanted to flag that there'll be more coming from this task force on state actions. So I'm going to drop a list into here into chat from our policy roadmap for states. There you go. All right. Questions, comments? Okay. Next slide. Wanted to get into treatment. I know most of you understand what current evidence-based treatment is for maternal mental health disorders. Here's just a snippet, an example of what's considered evidence-based, and then spend a little more time talking about the newer treatments or interventions that have been released in the last 12 months to keep you up to date. But so first, just wanted to share that psychotherapy or talk therapy, such as cognitive behavioral therapy, CBT, there's other types of therapy too, like IPT, is considered an important first line treatment for those with mild to moderate depression. Medication, of course, can be utilized from moderate to severe depression and anxiety. Meditation, yoga, exercise, all of that is evidence-based as well, and I think very much underutilized. Omega-3s, folic acid, vitamin D3 are also linked to not only lower levels linked to depression and potentially anxiety, but also increasing omega-3 intake, folic acid, vitamin D, for example, can also resolve symptoms according to research. Improved sleep, of course, can really make a difference. So just an example of some of the evidence-based treatments. We have a list of all of the evidence-based treatments on our website in what we call a menu of interventions and treatment options. I'm going to drop it into chat for you. It was just re-released this year, and it was modified from the MCPAP for moms, the Massachusetts Child Psychiatry Access Program for Moms, the telepsych program, several, I don't know, 7 or 8 years ago, modified from their initial treatment menu, and it included additional interventions for prevention. And it was just updated this year by our team. So take a look at that. And then the next slide, we wanted to go over some of the latest treatments that have made headlines in the last 12 months. Oop, and I see the pictures over some of this. I think folks now know about the new FDA-approved postpartum depression drug treatment. It's the oral pill that is now available, that was approved by the FDA. I think it was in October of last year. It's called Zulresso, is the non-brand name, and Zurzuvae is the brand name drug. It was developed by Sage Therapeutics. You can find information on our website about this drug treatment. What I want folks to understand, there's been some great movement on coverage for this drug treatment. In the early stages, folks were seeing the headlines, how much the cost to what are called pharmacy benefit management companies, PBMs, that purchase drugs, the cost to those PBMs, the initial cost was $15,000, but there's a negotiation process. So the price comes down even through those PBM negotiations. And then the drug is placed on what's called a formulary. Usually it's a top tier of the drug formulary for the health plan or insurer, since it's the only one in its class. And then patients pay a copay or a co-insurance. They might have to meet their deductible if they're a commercially insured patient for Medicaid, and really usually no deductible on those plans. All that to say that the affordability issue has largely been resolved, and that we're starting to see more providers prescribe and feel comfortable prescribing this drug treatment. It works in a matter of days for I think it was 98% of the patients saw resolved symptomatology within 2 days. So pretty remarkable in terms of immediate results, and really, I think, important new drug treatment for those with severe postpartum depression to have that immediate relief. What's also exciting about this is that obstetric care providers are more likely to feel comfortable prescribing this, although there's still some concern, and like, the first time prescribing is always a little bit nerve-wracking, a new drug. But what's nice about it is that patients can get support from their obstetric care providers with prescribing this drug treatment right away versus being referred out to psychiatry, which we know there can be long wait times to find access to in-network psychiatrists, up to 6 to 8 weeks or longer. And often, we refer to psychiatrists when patients need what OBs and others refer to as cocktails, so multiple medications. Maybe the medication first prescribed doesn't work and the dosage has to be increased, or another drug layered on. All of these things make it more overwhelming for obstetric care providers to manage. This is just one prescription, immediate results, so less of a need to refer out to psychiatry. So pretty exciting. It is available nationally. See your question, Jen. It's available across the country. There's I think only one Medicaid plan that hasn't yet made a decision on coverage. And for those, there's one state Medicaid agency that I recall is not covering it. And I think there's some sort of reconsideration happening. All that to say, Sage Therapeutics has a link on their website for anyone who doesn't have access to get access through Sage's customer support program. So even if there isn't coverage available in a particular state, or a patient receives a denial, the patient can go to their customer support page. I will drop a link to that into chat. So safe to breastfeed. I've heard two different things. One from the researcher who was the principal investigator. And I will actually send this all to you after today's session, because I want to pull the right information. But some would just say, you should just not breastfeed. You can pump and dump, but don't breastfeed during the duration, of the 8 days. It's better to not breastfeed. And I also have heard someone else say, it's not that you couldn't breastfeed, and I can't remember the exact disclaimers that she provided. So let me find those disclaimers and send them to you. I bet they're on the Sage Therapeutics website too, but let me dig those up and share them with you. Good question, Jen. Any other questions about Zurzuvae? We have a new report that we will be producing in the next 4 weeks, I would say, to update what we saw. We did a report on coverage and looking at coverage policies for the drug when it came out earlier or late last year. And sadly, there's such a delay on production of coverage policies. And so many of those national insurers did not have coverage policies produced. Again, I think that's a shame. They should be produced right away, particularly for new drugs that are first in class, the first PPD specific drug. But all that to say, there has been some progress on coverage policies being in print. And so we're going to be doing a separate analysis. And so far, a separate report. So far, what we're seeing is that really some great progress around drug coverage positions being produced. And for the most part, most of them not being particularly onerous, meaning like requiring prior authorization or step therapy, tried these drugs first. I think there's one or two insurers out of many that are going down that path. We hope that those requirements will be overturned at some point. It sort of defeats the purpose from my perspective of having such a important treatment available that can provide immediate symptom relief. So anyway, stay tuned for that new coverage report. But I've just given you kind of the the snapshot is that a lot of great progress and overall, solid coverage positions being produced. There's also now a new postpartum depression specific digital therapeutic that was approved by the FDA. So the very first digital solution, which really means that there's an interface available through an app, but also this company provides coaches and talk therapy as well. The program is called Mama Lift, and we're going to be doing a report on coverage policies for digital therapeutics as well. Sadly, there's a lot of work to be done around digital therapeutic, education among providers and I think payers as well. We believe that these digital therapeutics should be put on formularies, just like drug treatments are. Anything that's FDA approved should be on a formulary, and there should be a coverage policy that describes how the payer will cover it. So more to come on that. I am going to drop into chat our very high-level blog post on this drug treatment. We have a new blog post coming out with more detail. We recently met with the company to get some additional feedback on how it's prescribed and what does it look like for the patient experience. So more information to come on that, but wanted you to know about this new drug treatment as well. The way I see this working is that this could be prescribed by obstetric care providers for anyone with mild to moderate maternal depression. And then, and it doesn't have to be specific to postpartum depression, by the way, even though that's what the initial study looked at, postpartum depression specifically. There's no reason why it couldn't be prescribed outside of the postpartum period. And then, of course, Zurzuvae being available for those with severe depression, or my thought would be moderate depression, but with those with moderate depression and a prior history of depression, no need to wait until it becomes severe. Again, my thought, not being a clinician, but sort of taking in all that we've been following and hearing from Sage Therapeutics and researchers, etc. Questions on Mama Lift, the digital therapeutic that can be prescribed? Okay, stay tuned for more information. We're really excited about following that, just as we followed the first FDA-approved drug treatment. The other thing I wanted to flag for all of you, we did a blog post on this as well, that you may hear about. I think there's going to be, I suspect the company is going to be doing more studies. Basically, they published in a peer-reviewed journal a shake supplement, an all-natural supplement that's being sold on Amazon now to prevent, and I think that should say, it says PPD, but it's really the blues, postpartum blues, the baby blues. And potentially their news release says, if you can prevent the blues, maybe you can prevent PPD, but perhaps not, enough evidence yet of that. But there was a peer-reviewed study that was published on this shake supplement. So just to be aware of that. I don't see that anyone's making much noise around it yet, but wanted to make sure that you all were aware in case you hear about it. Questions or comments on these treatments or interventions? All right. I will also say, there have been quite a few studies on things like peer support delivered or community health worker delivered behavioral activation, other types of treatments like that, of course, that don't have like brand names. So we're not hearing about them in the headlines per se, but do want to flag that I think there's going to be more and more support around behavioral health, behavioral activation delivered by, lay professionals or community-based professionals. We're actually running our own pilot using CHWs to provide behavioral activation, and that will be published in probably 18 months or so. Thank you for that, Britta. Appreciate the the link to the article on, I think this was the Blues Away. Yep, the dietary supplement in the Lancet. Thank you. Alrighty. Other questions, comments? Yeah, Amazon. I mean, the way I think about this supplement is that it's like a, someone that produces a vitamin D supplement. None of that is regulated by the FDA. So it's all natural, and they say like, what is it, blueberry extract and things like that. So I don't think it's something that would cause any harm to folks. That's my, again, non-clinical opinion after reviewing, non-clinician opinion after reviewing the research and the availability of this supplement. All right, next slide. Oh, whoops, this was my error. We will skip this. This is tied to the report card. I think I placed our treatment slides in the wrong place. So we're going to move into psychosis and the law, maternal mental health and the law. And I wanted to start by going over what is postpartum psychosis. All of you, I think, know these facts, but it's helpful to have a reminder. The first thing is that we wanted to share that postpartum psychosis, you might hear that it's rare. And that's really, we mean rare in comparison to postpartum depression, for example. It's not considered a rare disorder by the medical field overall. Like, it doesn't meet criteria for rare disorders, but it's rare compared to the other maternal mental health disorders. Generally, we see this in the postpartum period. I think there's research needed to look at this in pregnancy. We've heard of some tragedies occurring in pregnancy, probably unresolved psychosis or bipolar disorder from the postpartum period that carries on into pregnancy. So just to point out that, mostly what we hear about is postpartum psychosis, but potentially could see some of this in pregnancy as well, even though there is not strong literature yet around that. What does it look like? So it's sudden onset of symptoms, usually within 2 weeks in the postpartum period. The most significant risk factors for postpartum psychosis are personal or family history of bipolar disorder or a previous episode of psychosis. It's considered a medical emergency due to the potential for harm to the mother or her herself, harming herself or her baby. What else do we want to share about postpartum psychosis? It can be triggered by a lack of sleep, which is something we really want to flag and get folks thinking about. Lack of sleep can trigger a mania if it's an underlying undiagnosed or even diagnosed bipolar disorder. And so lack of sleep is a really important flag. And if a mother is already in what is considered a manic state, then we need to be, and that means inability to sleep and feeling sort of high, right? The bipolar, sort of the manic state versus the depressed state. Then we should very much be flagging that mother as needing immediate care as well, not just if she's in an active psychotic state. So we have a symptom checklist for psychosis because mothers who are in an actual psychotic episode are not in their right minds and wouldn't be able to assess their own symptoms, right? So it's a symptom checklist that family and others can look at, including clinicians. I'm dropping this into chat. Here's our list of all screening tools, and the psychosis checklist is on that page. Here's the actual direct link to the psychosis checklist. So again, just wanted to flag that, this disorder is really important for us to keep an eye out on. And when we hear about tragedies in the media, sometimes mislabeled as postpartum depression. Usually it's a postpartum psychosis, and quite a few suicides, or a high percentage of maternal suicides, we believe now, are actually tied to psychosis versus depression. So really important to understand the distinction there. We like to share, like, what is it like to be in a psychotic state? That it could be like being in a bad dream or a good dream. So, and we all know what that's like when you're sort of like half aware too of your dream, and maybe you're being chased by something that's awful, and you kind of want to get out of the dream and you can't. Um, there's also could be a beautiful dream that you're in, that feels, real perhaps in your mind, and it's really not, right? You're in a dream state. It's a similar situation to what mothers are going through in a state of psychosis. So, really important to understand that when someone is having intrusive thoughts, like counter to psychosis, having intrusive thoughts or unwanted thoughts about maybe harm coming to their baby or something, there's this concept of ego dystonic. So do you recognize the thoughts or do you not? Are you in a psychotic state and you don't recognize that something's off? Those with intrusive thoughts do have this self-awareness that something's not right. And that's the difference. Often, again, OCD and intrusive thoughts can be confused with psychosis, just because somebody has a thought of something awful coming, harm coming to the baby, like dropping the baby off the stairs, or knives harming the baby in their home. That's not psychosis. That's an intrusive thought. All right, so enough about that. Questions about psychosis? Again, encourage you to take a look at the screening tools and the psychosis symptom checklist, which has a lot of background on what is psychosis and research citations. Okay. Next slide, Stacy. So I'll talk to you just a little bit about one state in particular who's taken action on addressing psychosis as a mitigating factor in the criminal justice system. So I mentioned earlier that a mother will face increased risk of harming herself or her children, and that we often see tragedies like the one in Massachusetts last year, the Clancy case, where a labor and delivery nurse took the lives of her children and attempted to take her own life by jumping out of her second-story home window, and she survived, and it made national headlines. How could something like this happen? She was suffering from a postpartum psychosis, and now there's some sort of thought that she actually was suffering from medication-induced psychosis, because she was on, I don't remember the exact number of drugs, but there were, I think, 7 or more drugs that she was taking. She had been in one of the treatment programs for mental illness that was well recognized in the state, and yet, this still happened. And so it's sort of fascinating that, how could she have been missed in that system? And it looked as if perhaps her psychosis was triggered by all the medications that she was prescribed tragically. So Illinois took action because a judge actually was seeing many mothers who had attempted in a psychotic state to harm their children. This judge was moved to do something about it, knowing that these women were still in, prison, perhaps for lifelong sentences, and that they deserved treatment versus, being in prison the rest of their lives. And so that judge took it upon himself to work on policy once he retired, and partnered with a nonprofit organization in Illinois and some clinicians in Illinois to get this bill introduced and actually signed into law. It really just looks at people who are already facing sentences for postpartum psychosis and looks to reduce their sentences if they were if it was a mother who was suffering from a maternal mental health disorder or psychosis at the time of the crime. So other states have considered such legislation. Massachusetts is an example of a state. We actually heard from Beth Buxton, who presented at our last session through an email just today about where their bill stands. If anyone's interested in learning more, we can forward you that bill. Didn't move forward last year, but it looks like potentially being reconsidered in the coming year or so. Texas has also passed a psychosis as a mitigating factor law. We are happy to share that with folks who are interested. And there was a lot of coverage around some of that work, including Postpartum Support International, tracking that work. There was a defense attorney who is quite well known in the maternal mental health field who led that work and attempted to pass these laws a couple of times, and did eventually see some law pass in Texas around this. Questions or comments about the criminal justice system and postpartum psychosis? We're not expecting that you would be experts in any of this. It's really just to raise your awareness before graduation that there are laws like this that are being introduced and passed in various states. No questions or comments? All right, we're gonna.
I'm sorry, I couldn't get myself off of mute fast enough. I'm wondering whether or not there might be like an inventory of some of this model legislation that can be available to us if on the drive or someplace else. That would be tremendously helpful if it exists.
Yeah, I mean, Illinois is considered the model legislation right now. Stace, we'll have these slides and a link. Crystal, can you drop the link to the Illinois law into chat?
Sure.
We do also have our state policy page on the Policy Center website where you can pop around and look at this is for legislation that passed. Look at Illinois' law anytime, and then I'm going to double check that the Texas law is actually on the Texas page. So, but Illinois is considered the model, and we will double check that we have that in our model legislation on our model legislation page. I'm going to put that as a takeaway. Great question and call out.
Thank you very much. We appreciate it. It's always more helpful to have like the actual bill text language so that we can modify it to suit our state's needs. So if any of that exists or could be disseminated, that would be fantastic.
Yep, and Crystal's dropping that link into chat right now, so you're welcome to grab it now, and then we'll also make sure it's on our webpage. That's great call out. Thank you for that question. Awesome. Crystal, I think you dropped it. Yes, very good. Excellent. Anything else on this? I will also share that, why we think Illinois and Massachusetts could have been successful and hopefully will be with passing a law like this is because they already have passed baseline laws in their state about maternal mental health more broadly. So you wouldn't want to lead with a law like this, perhaps in a very liberal, progressive state, you could pass a law like this, but in most cases, you would have to have some background and some prior legislative history around, maternal mental health more broadly. And so if you look at Illinois' page, the link that I dropped into chat, you'll see Illinois has had a history of introducing and passing maternal mental health laws for quite some time. And so logically, this would have been a good next step. So you wouldn't want to start with this type of law. California has considered some of this before. Crystal will remember there was an effort and still has been efforts to look at mass incarceration or the cost to state of incarcerating people who perhaps would do better outside of the prison system, and identifying this population as a population that would be a priority area. So there has been some conversations even in progressive state like California, and things there hasn't been much traction of late. So hopefully that's additional background too. That would be helpful. All right, Stacey, I think we move on to the next slide. We're going to move into media advocacy. Crystal, I'm going to turn off my camera and invite you to turn yours on. And we're going to get to hear about a journey that then 2020 Mom, now the Policy Center, took around our California advocacy work with the reporter April Demboski. And Crystal, over to you.
Thank you. It's a pleasure to be here with you all again. Want to just talk to you all a little bit about ways you can be intentional and creative in your media advocacy, and ways that the media can really uplift the work that you're already doing within your state. So what I want you to get out of the little story, just Joy said, I'll take you on the journey through how April Demboski's writing and subsequent work really supported the advocacy efforts that we were leading at the time, and then sort of snowballed into other opportunities. So would like to first encourage you all to build a relationship with a reporter. Whatever outlet best serves the people that you would like to be in touch with. For us, we found that KQED was a local station. There's also that feeds into NPR nationally. And we found in April Demboski a reporter who was uniquely interested in mental health due to a personal story. So she was already writing on health matters and health issues, but took a particular interest in mental health. So when you're looking for a reporter or someone to interact with, look for someone who has aligning interests. So whether they're writing on policy, mental health, could be simple as motherhood and parenting, or about the healthcare system. You can find past pieces that they've written on and reach out to them and tell them what you loved about the piece, or maybe you want to encourage them to do a follow-up piece. But see if there's someone you can align yourself with who's interested in what you're bringing forward, and they can often amplify your story in a really unique way. So this, just a couple pictures to give you a level set of who we're talking through here. This is April Demboski on the left. And then one of the first stories that she wrote on a mother was when her baby, Nico, Miriam there with Nico when he was just brand new. And then the last story she wrote on him there when he, I think, is 4.5. So she's followed a lot of journeys with us through the years. So we can go to the next slide, Stacy. So starting off in 2018, so when the Policy Center then as 2020 Mom was working on the package of legislation that came out of the task force report from the California Maternal Mental Health Task Force, April took a unique interest in what those bills would do and how they would impact maternal mental health. Stace, you can click on that first link if you don't mind, and just want to show sort of how that first story started to take shape there. So she'd heard about this subset of laws. Joy, I don't know if I'm misspeaking in saying that you reached out to her directly, or if I don't know if it was Wendy, but Wendy asked you pictured there as a maternal mental health champion in Monterey, who did a lot of work advocating for those bills, and I think served on the task force as well. So she originally was talking about the legislation and what the legislation would do for mothers in the state of California. And then you can go back to the slide, Stace, and click on that next article. I'd just like to show the progression that what then happened next is that there was a social media post that went viral about a local mom in Sacramento. And so again, through that relationship with April, flagged that for her and said, this aligns directly with the bills that we've been advocating for that you just recently wrote on. So she took the opportunity to interview that mother and to write on her story, which I think even furthered her interest in wanting to understand how mothers are and are not getting treatment in California. And then we can go back. to the slides again. Thank you, Stacy. I'll leave that there. I just want to flag for you all, these articles are all included in the slides, but then she also wrote about a mom who ended up in a psychiatric unit in 2019. And then in 2020, excuse me, a direct coverage of a direct urge to the governor to reconsider cuts to maternal mental health care for a bill that had sunset. We can go to the next slide, Stace. One thing I want to point out as we're showing all these big wins that we had with this really invested reporter was that she also did not take every pitch that we brought forward. So there were certain times that we brought forward a mom that we were advocating for, or a bill that we were advocating for, or we were being blocked by a particular legislator who did not have the interest that we had about a particular bill. Or if there was an organization that was pushing back, we would continue to reach out to her and say, would you like to write follow-up on this? Is this of interest to you? And it didn't always land, but she always kept the door open for us to continue asking. And so then in 2021, we were advocating for a mom who was unable to get access to Zulresso, which at the time was the only FDA-approved postpartum depression drug. And that was Miriam, who was pictured in those photos a couple slides back. April took a unique interest in the policies that Kaiser had put forward and showing that she was unable to get access to the medications. Is that first link there, Stace? Do you mind? I think we might have gotten them backwards, but I want to see in 2021. The 2024 is the follow-up. No, it must be the first one under 2024. We might have put the two of them together. Yeah, thank you very much. So the two stories that you can read here are specifically about Miriam and her challenges within the Kaiser healthcare system, her doctors and wanting her to have 4 failed medications before they were going to give her access to Zulresso, which at the time was only approved for I think it's still only approved for the first 6 months postpartum. So effectively making it completely impossible for her to get access to the drug. The article that she then posted earlier this year explains the follow-up from Kaiser, who has now changed their policy on access to the drug. So very exciting outcomes, and really directly because of her putting it out there in the media and the stories being able to be displayed both here in California and then nationally through NPR. And I'll pause. I know I just fed all of that to you very quickly. Does anyone have questions or thoughts about a relationship you've had with a reporter or someone in the media? I know we've focused previously on social media. This is more about relationship building with someone who has access to a media outlet that you're interested in. And you're welcome to come off mute or put a question in the chat.
This is Leah from Utah. It's kind of a question, but also just to highlight something Utah has been doing. So the question part is, have you done much work with this reporter or other reporters regarding safe messaging? And I ask because that's been a focus in Utah for a number of years, is to ensure our news media has the specific training for safe messaging in the suicide prevention space. But we've also seen a really great return in just how they report on mental health broadly.
I love
go ahead. I was just going to say there was some investment by the California Healthcare Foundation around developing, media training, including training for television producers in California and Los Angeles. That I'm going to find a link to some of that. It does feel like there's been some really helpful training that's become available, which April may have gone through that training. We were not involved in promoting any kind of training with any of the media we've worked with. But I think it's a really great call out. And of course, we would point to our website that has an overview of the disorders. And she took a big interest, as you can see, in psychosis in particular. And she actually had a prior relationship with a boyfriend who suffered from postpartum, or from psychosis rather. So personal interest in psychosis. Crystal, go ahead and add anything else you might want to add.
Yeah, I was just gonna say, I would love to hear more about what Utah's doing around media training or media safe messaging. And also just say reflectively that I know that here locally, like in my town in particular, I have reached out to my local media if they've been reporting on mental health and pointed them back to resources to make sure that they're reporting in a safe manner. But I would love to hear anything more about what you're doing, or, I mean, I think it's also a great way to engage. If you find someone who's reporting on the case and you can reach out and say, hey, I'd like to, on behalf of either myself or my organization or as part of this cohort, make sure that you understand what safe messaging is and the risks that you're putting out to our community if you don't understand.
Yeah, we really, again, started in the suicide prevention space, and we were really lucky within our department to have a really invested public information officer. And so pre-pandemic, a lot of connecting with our media channels, both written, print, and radio, about doing training for their reporters. You know, obviously the pandemic took a little bit of a, twist on that training, but really still pushing out that training to the reporters, or, building those relationships with news entities. So when maybe stories aren't having the maybe they have a negative impact, they're able to do a little bit of work to change the story. We also developed a safe messaging training, which folks can take in the community. So we really are looking at, of course, what language is used, but also what visuals, and ensuring resources are attached to that. So that's something actually our suicide prevention team built and developed and really pushed out, but it's really talking about mental health broadly. And we've actually been able to see some really great responses from the community and how messages are put out there, and always attaching resources and correct resources. So it's great to actually see it in real time, in news, prints, TV and radio, and just even community events.
Yeah, absolutely. And what a gift for your community too. That's wonderful. Thank you so much for sharing that. Does anyone else have a thought, reflection, or a question? Yeah, go ahead.
I was just going to say, it's Joy. I dropped into chat the Media Impact Project.org's resources on mental health and how television, radio, etc. can help influence mental health outcomes in a positive manner.
Great. Thank you so much. All right, Stacey, I think you can go to the next slide. Thank you so much. All right, Joy, I'll bring you, I mean, we already started our roundtable discussion, but bring it back to you for anything else you'd like to add.
Yeah, we just wanted to open it up for larger roundtable and conversation about anything you heard today. You saw probably a through line around psychosis and the media, also the drug treatments, the new drug treatments and treatments that are available, and just wanted to pause to see if anyone has any additional reflections on the content today. If not, we're going to open it up to larger conversation, not about graduation because we have specific slides on that, but anything else that you feel like you want to scratch the surface on in our last class before we present at graduation next month. Okay, I think we can move on, and you all know that email doors are open, text doors are open. If you have questions or comments or read something or can't find something on our website, all of those doors are open for ongoing conversation. We also have our listserv, as you all know, that Stacey uses to communicate with you. I'm going to drop that email into chat so you can put it in your contacts if you haven't yet. We, at the beginning of our class, had everyone email that listserv. So if you put in MMH fellow, it should pop up, but I'll drop it into chat just to make sure you all have that available to you as well. And don't be shy about continuing the conversation on any of these topics. So we can move on to the next slide. So we wanted to just give you some suggested reading and some next steps. In addition to the articles that were linked, and we'll fix the one article that didn't come through linked correctly in the ordering issue that Crystal mentioned, we'll make sure that it's fixed on the slides before we save them. But we also wanted to drop this link into chat. And Crystal, if you don't mind grabbing this this recording, it's actually an audio recording, an interview that April did on postpartum psychosis and infanticide. We think this would be a nice thing to kind of tie it all together. It could be, a trigger alert. We've listened to a portion of it in our prior classes, and we didn't want to take the time today because there was new content today, but encourage you all to pop that link open on your website and listen to it sometime this week. It's really powerful and will help you understand psychosis and infanticide, and also the role that reporters can play in helping to bring shed light on these important issues. And then just a reminder, next steps to consider drafting a report card, op-ed template, or even just pushing out your state report card to a local reporter if you don't want to write an op-ed, to say we'd love for you to do a story on this. Questions about these next steps? We also, of course, have a little work to do to finish preparing for graduation and your fine-tuning your action plans. If you haven't sent those to us yet, we'll talk about that in just a minute. Make sure you're feeling ready. Before we move into reminders about graduation and your action plans and kind of wrapping up our live time together through the cohort, we wanted to ask for your feedback about today's session. And you can drop it into chat. What did you like about today's session? Or you can say it verbally. Anything you would change? And would love for anyone to just take themselves off mute and share anything that you liked about the session or would suggest that we change. What did you think about covering psychosis and the law or psychosis? Was that helpful? Anyone brave enough to unmute and share a little feedback? All right, well, please don't be shy later. If you do have some thoughts on what you liked about today's session, just shoot off a quick email to us or drop it into chat. We can move on to the next slide. We have a mandatory post-test. So we use this for evaluation on the program. We gave you all a pre-test. Most of you completed it, a couple of you didn't. And now we're doing a post-test to check on whether or not we covered the content that we said we would cover. And we use this for evaluation of our program and also for our funders to see how the program is working and is it working as we hope. So we're going to drop that link into chat. Crystal, if you don't mind grabbing that link for us and dropping it into chat, we're going to give you a few minutes to complete the post test now with us live. So we'll take about 3-4 minutes. There it is, Google form. So if you can complete that now, and we want each of you to take time to do that, not just one person in your cohort. We will also be sharing an overall evaluation, and you'll have an opportunity to add free-form comments about the program. This again is just to measure changes in understanding about the topics that we covered in the cohort with you. All right, I think that's been enough time, so we can go ahead and move on to the next slide. Just as we recap on all that we've discussed in our sessions together, we want to just remind you again about the recipe for state policy change that we presented in our very first session. Just as it's helpful as you're refining or finishing up your action plans, these are the steps that we encourage folks to take. If you're with a state agency, some of this is perhaps a little bit different, since you can't introduce legislation, although some of you in some states are comfortable doing that. But the first is really to host a stakeholder meeting, and many of you have already done this, which is exciting. Multiple stakeholders, multiple players, to share a little bit about maternal mental health, gather. Some of you hosted a lunch. We have the resources on our website, including a template invitation, template slides. All of those things exist. We also are encouraging all of you to have some sort of resolution, either a proclamation from the governor, a legislative resolution, to declare May as Maternal Mental Health Awareness Month. Some of you are doing weeks or days. That's fine too. The idea is just to have the state proclaim at least one day, maybe the whole month, as a Maternal Mental Health Awareness Month, day, week. This kind of primes the pump, as we say, for taking more action in the state around maternal mental health. Number 3 talks about the formation of a task force or a commission to study maternal mental health in your state and issue a report to the state legislature and or governor, HHS. We have model resolutions and law language on your drive and on our website for making this happen. It can be publicly funded through the state or privately funded, and a resolution with philanthropic dollars, which is a powerful way to get philanthropy involved. All of that again is on the drive. Then the report gets, the commission runs or the task force runs and issues a report. That's, pretty intense work that either you all could lead with proper appointments by those necessary call outs in the resolution, or other organizations could lead that work, and hopefully you be directly engaged. And then the report gets released, and then strategies kind of assigned, and then legislation usually, or regulation when there's agency authority, gets developed to fill gaps and take permanent steps to make permanent change in the state around maternal mental health. So this is the recipe that we promote, and hopefully we'll see at least one of these steps in all of your state strategic plans, or action plans rather, that will be published and produced and shared at graduation. Questions, comments about this? Okay. Next slide. Slide, please. So Stacy, I'm going to turn it over to you to share more about graduation.
All right. Hello, everyone. Can't believe this program is wrapping up. It's been so nice. So you all know that our graduation date is Wednesday, June 12th at the same time. We're going to have each state group presenting in order of alphabetically, by state name. So that's the lineup you can expect. If for some reason both you and your partner in this cohort cannot make this, we need to know ASAP as we're planning around all of this. If that's the case, we also would like for you both to record your presentation and share it with us, just so that the cohort can see everything that you all have been working on. And anyone who's joined, can also see the work that you've put so much time and effort in. So please let us know. Just email me directly, and we can take care of that. There is going to be some time for Q&A. So after your presentations, we will make sure we leave time for that. Joy, I don't know if you're going to want to do them right after each presentation or just save everything to the end. Usually, last time we left it to the end, so I'm assuming we're going to do that same thing. But
Probably a little bit of both. Sometimes we have burning questions, and it's a really exciting time. It sounds formal when we talk about graduation, but it's a conversation, and presentation to get everyone excited about the great work. The funder of the program attends, Sage, and then we also, as Stacy wrote up at the top, want you to invite the folks that wrote your letters of recommendation, and others to attend graduation and watch your presentation. Think about, Stacy, I just jumped in here, but think about, who are key players that you need to have them buy into your implementation plan, that should be here to hear about maternal mental health more broadly, get excited about what other states are doing, and then hear you present. So be strategic about who you invite. Stacy, I'll turn it back to you to talk about the other items and also how to extend an invitation to these folks.
Exactly. So you already have the calendar invitation that was set up specifically for you all to forward to those that you would like to invite. In the body of that calendar invitation, it just is a little blurb about what this is. There's also a link to a form, an RSVP form, that's asking, so for our records, who is attending that's not our policy fellows, who invited you, so we have that background. I don't see any RSVPs that have come in from that. So
we can send, well, Stacy, let's go ahead and get the invitation and the blurb about the graduation out to all of our participants, the whole cohort, to forward on to others. And then you can also forward the calendar hold. We'll resend that.
I do know that some people from Utah were trying to register, and they were actually having some problem with that RSVP link. It wasn't allowing them to RSVP.
Well, we better check that. Thanks for that.
Oh, thank you. Yep. And so, yeah, if you've invited anybody, please let us know if they've had trouble also, but we'll take a look at it here shortly and we'll recirculate. I'm going to put my slides back up. So again, you've already got the template for the slides. So please keep your slides to 2 to 3 slides per presentation. So we want to make sure that we know that some of your action plans are, quite detailed, and we love that. Just pick the top 2 or 3 points you really want to, hone in on that are most important. We know there's going to be more than that, but sum it up as much as you can. 5 minutes per state group. We are going to be running time to make sure we get everybody a chance and still have that time for Q&A. As you can see here too, we've asked for the final action plan document and your final slide presentation. So those 2 separate things should be sent to me via email by Friday. And if you've got a problem with meeting that deadline, just send me a note and let me know what's going on. But that way it gives me time to put them together. I'm going to be running the slides that day. So I will move them forward for you. I'll advance. So that just allows me time to put that all together and make sure we've got everything ready. So I think that's it from me. Does anybody have any questions?
I'll just quickly remind folks too, as we're waiting for questions, that remember your action plan should be focused on policy action. So you might be doing some other great things as a result of the cohort that sort of inspired change, but your action plan should be focused on policy. So, I mentioned previously that Colorado created a training program on SUD. That would be considered to me a programmatic change, which is great, but not something that you would necessarily highlight in your action plan around policy steps. If you were creating a training program that was going to become mandatory for, let's say, obstetric care providers, and there was going to be new reimbursement codes around various things that an obstetric care provider, for example, would do around SUD. Those are the policy steps that you would put in your action plan. You know, you could mention that you're also rolling out as part of these policy steps, development of training, but the training in of itself would not be something you would highlight in your action plan. So I just want to give that example. I think all of us in our TA sessions, have discussed that again, but just be focused on the policy steps for presentation at graduation. And Stace, you'll resend the slide template today or when we send out the recording. If you don't have it handy, you'll get it again soon. And
It's also in the folder for everyone, but yes, I can send it out, but it's accessible right now in your materials folder.
Excellent. Other questions? Okay, Stace, we can go to the next slide, I think. There's the date. And
That's it.
and then we also just want to remind you that we're keeping the listserv open. We will also be doing group technical assistance sessions on a quarterly basis with all of our prior fellows too. They're really fun. So even if you don't have questions yourself, but just want to connect with other people doing this work and hear what's going on. Sometimes we do actual presentations on various things. We did a good TA session on maternal mental health screening and some of the policy implications and what's changing with HEDIS and those types of things. That's an example. So stay on the lookout for those group TA sessions, and then don't be shy about asking for one-on-one TA sessions. We'll offer those in email too, but really we will continue to follow your progress around implementation for our reporting purposes, and just appreciate the ongoing relationship that we'll continue to maintain with all of you. It's been really fun. Cannot wait to see all of your presentations at graduation.
Yep. And I think I already mentioned this. I'll also just throw in a heads up that we will be doing a group photo probably before we get started, just to make sure, we're excited for you and we want to boast about you on our social media, all of that stuff. So please be camera ready. We will ask you to turn your video on while we do that before we get started with our presentations in just a couple.
We may actually ask you to print out your graduation certificates too and hold them up at graduation. We've done that before and that was a lot of fun. So Stacy will send more information via email. All right. Well, we're at time. Thanks, everyone. Thank you, Stacy. Thank you, Crystal, for presenting today. And we'll see everyone at graduation. Thanks all.
Thank you.